All right, so welcome everybody. Welcome to our parent night. Today we will hear a little bit about what changes we can expect in our children as they're entering puberty. My name is Julia Diekmann and I am the PCNC coordinator at WCMS. PCNC stands for Parent Community Networking Center. I will also put my contact info in the chat later. If you need to ever reach me, then please feel to contact me. Our topic today is help, I have a teenager, or how to support your child through puberty. And we have some very great panelists who work directly with all our kids at WCMS and who will share their knowledge and experience with us. And I'm very happy that they all here and agreed to do this this evening. So we have clinical psychologist Sarah from Puberty, school counselor Malik Cox, and family nurse practitioner Dr. Jessica Scott. Jessica will talk a little bit about the bodily changes in puberty and how you can start a conversation with your kids about that. Sarah will walk us through the mental changes occurring while your kids are going through puberty, and Malik will give some examples and advice for activities and solutions that we can try at home. Welcome everybody, and again, thank you very much for being here. We also have our vice principal here, Serena Cox. She will do a lot of the backstage stuff and also share later like a hands-on presentation on how to set up screen time limits for your kids on your phone. So welcome, Serena. And then lastly, we also have our principal here, Melissa Spetians. She is in the audience. Thank you very much for making this event happen. So first, I have a few housekeeping things. We are using a regular Zoom meeting for this event. Feel free to start your video if you would like to, but please stay muted so that we don't have any distracting background noises. If you would like to ask a question, you can use the chat function on Zoom, or you can also unmute yourself later when we do our Q&A rounds. We are recording this session, so you can go back and watch it again, or maybe share it with others who were not able to join today. I would like to put our chat function to work now. If you could find the chat icon at the bottom of your screen and type where you're joining us from, that would be awesome. You can, can be the town or maybe your ahupua'a or, whatever you want to share. So I'll start. I'm joining from Kalahea. All right, so we have our welcome screen up, and we would like to start with our first panelist, which is Dr. Jessica Scott. She is a family nurse practitioner at KVMH. Welcome, Jessica. And I would like to share a little bit more about her. She is the new Hawaii keiki provider based at Waimea High School and also serves the Kapa'a Kauai Waimea complex area. She has more than 20 years of experience in healthcare with a focus on vulnerable patient population. She holds a PhD in biomedical science, a degree from the University of South Florida, a Master's of Science in Nursing, and a Doctorate of Nursing Practice from University of South Florida. Dr. Scott has a wide range of experience from being a paramedic on a flight crew to practicing in a primary care clinic. Her passion for medical missions has led her to serve in Africa, South America, Haiti, Mexico, Costa Rica, and beyond. Her experience in emergency management, intensive care, and pediatrics has helped shape her focus toward preventative healthcare. She is excited to be a part of the Hawaii keiki team to extend healthcare access to our Kauai complex schools. Jessica, welcome and thank you for being here. I will give you the virtual floor for the first presentation, which is Puberty 101.
Thank you so much, Julia. Can everyone see me? Am I on the screen yet?
Just a moment.
Welcome, everyone. Thank you very much for attending this event. And thank you, Julia, for putting this very fun, awkward, cool experience about puberty so we can get our questions answered. So puberty one-on-one. Let's move to the next slide. Okay, so we're going to get right into it. What is puberty? It's a time when a person's body, feelings, relationships change from a child's into an adult's. There are several well-cast videos that help provide a really good resource for basic questions about puberty, healthcare, adolescence, that I really recommend that you try to tap into. You can just look up Wellcast on YouTube, and there's tons of resources for very awkward questions that may be difficult, and you're wondering how to present it to your child. Sometimes it's good just to kind of watch one of these quick little videos. They take anywhere from 3 to 5 minutes. And it's kind of a comical approach to your changing body and the different stages that we go through. And there's all kinds of resources there, everything from noticing depression to what do I do if I think my kid is vaping, to how do I have the talk with them. So I really recommend at least YouTubing it, putting in Wellcast and seeing all of that great information. That's can be a great resource. Okay, so let's go right into one of the Wellcast videos. We have a one for girls and one for boys. So they're both really short. They're about 4 minutes on the changes that girls will go through in puberty.
Did you know that if you live in one of these 10 states in America, you can get solar panels at absolutely no cost?
Hey, Wellcasters. Today we're going to cover puberty from the female perspective. And if you don't know what that means, it might be because you A, haven't gone through puberty yet, or B, you're a boy. So boys, listen up. This is what we're about to cover. Our periods, pubic hair, your boobs, and cellulite. Hang out if you want. Section 1, your period and how to prepare for it. So, somewhere between the ages of 7 and 13, your ovaries start pumping out the hormone estrogen. Essentially, this is to help prepare your body for an eventual pregnancy. Your ovaries are filled with thousands of eggs. Every month until menopause, your body passes an egg from your ovaries through the fallopian tube into the uterus, which, at this point, is lined with blood and extra tissue, which would help nourish and protect a hypothetical baby. But when you're not pregnant, your body spends the next 5 to 7 days getting rid of that stuff, which it doesn't need, and this results in your period. It sounds all really straightforward, but it kind of doesn't feel that way, so be prepared. First of all, your hormones surge, and it can do funny things to your mood. For your very first period, the ladies here at Wellcast suggest that you keep a stash of pads and an extra pair of panties around to avoid any embarrassing accidents, which happened to me a lot. It was really sad. Section 2, while we're on the subject of your nether regions, let's talk about your hair. Wellcasters, if you look real close, you have hair all over your body. The fine, short, vellus hair on your chest, back, and cheeks help regulate temperature and protect from little tiny things. Its cousin, terminal hair, which you find on your head, in your armpits, on other parts of your face, and in the nether regions, is coarser and means to protect. You'll probably be tempted to shave, pluck, or wax unwanted hair. And we've all been there, and some of us have gone a little bit too far. And the good news and the bad news is, guess what? It comes back. Welcome to womanhood. If you so choose, find the hair removal method that's right for you, but make sure that you do your research first on its risks and proper use. Section 3, ouch, my boobs! Tenderness around the nipples and breast area is totally normal as your breasts, fill out. And here's the bad news. They probably won't grow at the same rate as each other. Again, totally normal. You might notice some stretch marks as well if you experience rapid growth, good for you, in your breasts, hips, and thighs. Totally normal. Please don't worry. The stretch marks will fade with time, and I promise your boobs will stop hurting. until you are PMSing, and then they will hurt again. They're going to hurt once a month. Section 4, accept the cellulite. The cottage cheesy look cellulite causes is simply fat living just beneath the skin's surface. As your body grows, you're probably going to notice it a bit, especially around your thighs. But guess what? Most women and girls have cellulite, and it's almost entirely genetic. There's a certain amount of fat your body needs to continue and fully grow and develop into a woman. Think about it this way, ladies. For the rest of your life, your body's going to hang on to fat differently. And the reason is, deep down inside, it's thinking, wait, we might have a baby. Well, ladies of Wellcast, that was fun. Just kidding. I know it wasn't. We here at Wellcast hope you learned a thing or two about your body and your friend's body. And if you feel like the whole world is collapsing in around you, or you feel like an ogre, or you feel like your face has been taken over by this weird disease and you're never going to be attractive ever again, look around you. Every girl that you know is going through the same thing. Meeting adjourned. For more super cool facts about super cool puberty, check out these resources.
Great, so we'll go right into the boys.
So I've got my essay written, and I've been working on it for about a week. So now I'm going to show you how I use Grammarly to edit. Okay, so here's my edit.
Hey, Wellcasters. Fair warning, the following message is intended for pubescent boys. If you saw our first video on puberty, you learned that somewhere between the ages of 9 and 15, weird things start happening to your body and mind. Or you may have noticed this is actually just happening to you. Today, we're going to talk exclusively to the boys on what's happening in your body and how to deal with it. As a side note, ladies, we're working on one of these for you too. I'm sure you're super excited. Tip 1, here's a little secret about zits. You can't scare them into disappearing. Hormones, genetics, dead skin cells, and bacteria are having a party in your pores, and your whole face is invited. Think of squeezing zits like a nosy neighbor threatening to call the cops on a party. It might quiet the storm for a little bit, but as soon as the neighbor leaves, you can be sure the party will flare up again, maybe even louder. Hello, red irritated spots. You're best off washing your face regularly, especially after excessive sweating. But hey, don't wash your face too much, because that could irritate your skin too. Use only water-based hair products that won't drip down your face and clog your pores. Eat consciously so your skin gets the alphabet of vitamins it needs to glow. Pause and print this whole list of amazing foods that'll help you fight acne from the inside. If your skin is especially angry, don't hesitate to consult a dermatologist. It's okay. We all need a little help sometimes. And, you know, dermatologists are like psychiatrists for skin. Tip 2. Hey, can you hear me all the way up there? You're a little taller than the last time we spoke. One of the trickiest parts about puberty is that everyone develops at different rates. The once tallest guy in class suddenly finds himself looking up to girls. And the former class shrimp finds himself hitting his head on doorways. Hello. Here's the thing. The growth spurt part of puberty is kind of a free fall. You can't control your height or how fast you gain it, trust me. But what you can control is your posture. That's right, posture. A solid stance goes a long way to looking cool and composed, even if you're kind of short. It sounds old-fashioned, but seriously, straight, maintain eye contact, and speak clearly. You'll seem way more in control of your body than you actually feel. Tip 3, sperm, testosterone. Oh my! These are the hormones of our lives. And they're exactly what your body starts to produce when puberty kicks off. But as you probably have figured out, the changes aren't just happening inside. You can expect to gain some muscles all over as well as length and girth too. Hooray! You might also be struck with an erection when you least expect it, even in your sleep. And that's okay. These will lessen with time. And listen to me, this is happening to every single boy you know. Tip 4, apply deodorant early and often. We here at Wellcast prefer antiperspirants, which not only mask body odor, but help calm sweat glands to prevent your body from sweating as much in the first place. Look, in puberty, your sweat glands are working in overdrive, especially if you play after school sports or lift weights or whatever. So please carry an extra deodorant in your bag or keep one in your locker if and when you need to reapply. Tip 5, hair everywhere, or not. Facial hair has a mind of its own. Whether the root of your problems is either uncontrollable hair or not enough, you must accept that hair will come and go as it pleases. It's true. Just ask a bald guy who might also have a hairy back. So that's it. Well, for me, not for you. You're still in puberty. We hope you can breathe a little bit more easily knowing that you're not alone. And if you really want this inside scoop into what happens to girls during their teen years, well, stay tuned. We've got one on the way, just for the ladies. Don't worry, we won't tell them that you peaked. And if you need other puberty information resources, check out these sites.
So as you can see, these are fun little videos that are a great segue to open up the door of communication and provide to be an icebreaker. We had questions from parents about what are some good resources to start having those puberty conversations. And these conversations isn't just, oh, I had the talk with my kiddo and I had the talk and now we're done. It's many different conversations that can come up at different times. So I wouldn't recommend parents overwhelm themselves with having to think about every single topic or issue. But as you notice things and notice changes in your child, it's a good opportunity to start up a conversation. And these can be a great resource. Let's move to that next slide. Okay, so a recap, tips and tricks. So growth spurts, yep, we're at that phase where sometimes it happens quick and sometimes it happens later, but by clothes knowing that they may not wear them too long, or giving that they're approaching that preteen, they may not like them for very long either. So acne. Acne is one of those things where we let kids know that it's normal to have breakouts on your skin. We want to promote the good hygiene of face washing, especially after playing a sport or being sweaty all day, that they might need to go home from school and just wash off their face. No oil-based products on the skin. Maybe purchasing an over-the-counter facial cleanser for them to start using. If it does get to a point where you're noticing that the acne is getting a little bit uncontrolled and maybe you have a family history of cystic acne, it's a good idea to go ahead and get it established with a local dermatologist early. So that way you can prevent potential scarring and things from happening so it doesn't get out of hand. Most of the time it's not necessary to have a dermatologist, but there, especially if there's a family history, you might want to consider it if you see it happen early on. Another thing, sweat glands, they mentioned it, deodorant. I recommend practicing making it a routine. This is something that they haven't done in their routine, most likely in elementary school. So now in middle school, it's they might need that first year a little bit of a reminder to, brush your teeth and put on your deodorant before you go out the door. Sometimes throwing one in a gym bag or the backpack so they have it at school because they might forget to put it on even with verbal cues in the morning. And then the under arm hair, manscaping, womenscaping, kids start to experiment. The main thing to really be concerned about is that they're using clean razors. Discuss with them about never using a friend's or another family member's razor, that your razor is a personal item like your toothbrush is. And if using an old razor that needs to be changed out, there's always the risk of getting a staph infection or an abscess in the axillary, the armpit region. So if that does occur, just letting your kiddo know that they need to let you know so you can get them to your healthcare provider. So the genitals start to mature. That's one of those great well-cast videos, or another resource that it's great for parents just to give them that heads up. Just let them know that the body is going to start to change. They're probably already experiencing some changes, and if they know it's going to occur, there's most likely they'll embrace it a little bit more easier. So the breast development. As girls start to fill out a little bit, it's a good idea to buy those sports bras and things that even before they start completely developing, so they can get in the habit. You might notice that they wear them some days and it's very sporadic on when they like to wear them, but they have them available if they start feeling like, oh, I don't like the way I look in this outfit, or I feel like I need a little bit more coverage, they have it available. So sometimes it's nice to have it before the development even occurs. Menstruation for girls, the period begins. It talked about in that well-cast video, creating a little emergency kit, something that they can maybe start carrying in their backpack. Depending on the development of the girl, usually depending on their weight, menstruation is one of those things that generally occurs when a certain weight is reached. So if you notice that, oh, they've gained quite a bit within the last 6 months, it might be a good idea to really start having those talks and let them know the different signs that they can look for in having their first period. Okay, so ovulation begins. That means fertility begins, and pregnancy can occur at this stage. So once they get their period, making the child very aware that they can get pregnant at that stage, and having a family talk about that. Voice may deepen, crack, and sound very funny. And with our boys, we try not to laugh, and we embrace it and just encourage them through this change. And mood and behavior changes. So it's good to talk about what is the normal mood changes versus signs of serious depression. And we'll get into that in just a minute. Also, things that come up at this stage is interest in recreational drugs, just being curious in general. Vaping, smoking. Vaping's I just got some statistics last week from Oahu that 80% of kids in Oahu admit to vaping. And that's just what they admit to on a survey. So it's likely even more than that. So if you think that, oh, not my kid, you might want to look at those statistics and say, most likely it will be my kid. How are we going to make sure that this doesn't happen? So also, if there are medications in your medicine cabinets, this is a time of experimenting, making sure that those narcotic medications are locked up in your home is definitely a must. So let's move to that next slide. Okay, what to look for with depression. So signs that may be normal due to puberty. So moodiness, mood swings, wanting more freedom, testing boundaries, tantrums, looking for more independence. Do not think the parents are cool anymore, not listening to you, stubborn. You might think you have a behavioral health case on your hands. You don't. It's just your child going through puberty, which is can be a bit of a roller coaster. The signs that are a little bit more worrisome are things such as prolonged depressed mood. And we're talking weeks, months, maybe even the entire bit of the last year. Little interest in participating in activities. They used to love playing soccer. They used to love cheering. They used to love playing volleyball, and they just become more isolated. They don't really even have interest in hanging out with their friends anymore or doing the things that used to give them a lot of pleasure. That's something to start being a little bit concerned about. Difficulty in sleeping at night, not being able to stop worrying. And that's a hard, a lot of kids are experiencing that now, especially with the last couple of years of this pandemic. And they're kind of bearing the burden of their parents and the world and the school system. And they're just trying, and they don't feel like they have the ability to really control their environment. So it can cause excessive worrying, feeling anxious, nervous, on edge, feeling afraid as if something awful might happen, feelings of hopelessness. Nothing will ever get better. Beginning to self-harm, cutting, pulling hair out, constantly chewing on their nails. These are signs where you really need to get some extra help, and go ahead and take them to your PCP, and definitely look into the school counselor. So next slide.
Just a heads up, Jessica, you have about 2 minutes left.
Okay, so tips to properly use pads and dispose. So this is one thing that's a lot of times missed by parents and school staff. It's just that when they first start getting their period is what to do with things. So always remember to let them know to always wash hands before and after applying the pad. Always dispose of the pad in trash, not the toilet. Serious issues can be caused with the toilet backing up. Always check with your parent guardian on the rules of using a pad versus tampon. That would be a family conversation. And next slide. Okay, questions. Where to find resources. It's primarily, the resources start coming from the parents first. Kids need to hear these things from their parents. They need to feel like they can approach their parent when they have a question, and also from their doctor and their Hawaii Keiki school doctor, which they have in-house here at the high school that's available to any kid on the west side and family. So that's it from my end.
Thank you so much, Jessica. That was so much great information that you gave. I really enjoyed listening to that. And it's also a good reminder of all the changes that the kids are going through that, you know, we might not be aware of because it happened to us so long ago, right? But it's a really good reminder of all the stuff that's happening to them. So thank you for sharing all this information. I don't know if there are any questions in the chat. I didn't see any. So I had a question here that you kind of already touched on a little bit. What are the normal changes in puberty, and when do I need to seek help? So maybe if you could just recap that.
I'm sorry, say that again, Julia.
So the question that I had is like, and you already shared some of that. What are normal changes in puberty, and when do I need to seek help? So maybe if you could just recap that.
Yeah, so in general, we went through the girls, we went through the boys. We're gonna have some genital maturity. We're gonna have some mood changes. We're gonna have additional hair growth. And so that's when our hormones get started, the pheromones get started. So our sweat glands start to really be active, which weren't active before. So that new routine in the morning time of putting on deodorant is a routine that usually boys need to be reminded of quite often the first couple of years. So with all of these different changes, they're going to happen at different stages for every single kid, but over the next 4 years, it's going to happen.
Right. Awesome. Thank you very much. I don't think there's any more questions. So thank you again. That was super informative and helpful. And please stay on if there are maybe questions later for you.